I really needed to film this because I had like the most, I wouldn't say horrible, just like the most subpar, dissatisfying experience of patient care yesterday when I had my nerve block for my leg. Let me just tell you about the experience yesterday. It was just like pretty bad. I mean, the front desk people were like really great, and it was just like different nurses attending to me in a way, but not really. When the first person checked me in, apparently she was just helping out because it was that busy. She doesn't really work with patients. So she was. So when I told her about my CRPS for my hand and arm, she was like, what is that?" And I was like, what? This is so confusing. Like, how do you not know? This is why I'm here, because I have CRPS in my leg. But she was checking my BP and like the pulse. So she was going for my right arm. She wanted to put it on my right arm. And I told her, no, I don't have BP there because I have CRPS there. It's going to be uncomfortable. So I had to tell her what CRPS was, which I thought was weird because, hello, you're working in this surgery center, shouldn't you know? I'm sure I'm not the first patient with CRPS that came in. But anyways, I found out later that she's only like filling in and just trying to help out because they're that busy. So, okay, so now it makes sense why she wouldn't know, because she doesn't normally work back there with patients like myself. And I found this out because because she was asking a question to another nurse. I was like walking around there, and I don't know if she was a nurse or an assistant or what. I'll just call her like a assistant. Basically, she just said that she forgot to take a urinary sample or give me a urinary test. So yeah, so another one of the nurses was like, okay, how old is she? We have to do the urinary urinary test unless she's had like a hysterectomy or tubal ligation. And this is all happening in front of me. So, I get it. People learn and whatnot. But, hello, I'm having a freaking procedure. Another nurse who I could not really understand because she kept mumbling, and she was speaking so low too, you guys. She was speaking super low, and like, they didn't have me change out of a gown, and they didn't give me a hairnet. Okay, but then she was telling me, oh my god, I really have to go to the bathroom. Then she wouldn't go to the bathroom because I guess she was with me and with other patients. So she just kept telling me that the first nurse that was helping me out was, she tries to help, but she's not really there helping patients, but she at least tries because other people wouldn't try to help. Anyways, all the time I was just thinking, oh my god, that's so stressful. Like, I don't need to be hearing about, this other lady, and no, just like, yeah. And then when she was taking my allergies and like, she didn't even ask me about my previous medical history, but I guess that's okay if they have like, because I did complete everything online beforehand. But like my allergies, like I only told her one. She didn't ask if I had any others. I just told her like the main one. So anyways, and then she left. And I was sitting there for maybe 30 minutes, like waiting for a doctor, to be taken back. And then like I saw another patient like get put back into the recovery room, and then it was gonna be my turn. And then anyways, so my doctor came in super quick. Like, he didn't really say much. He just came down, looked at the paperwork, avoided eye contact. This is like the new pain specialist that I saw 3 weeks ago. Like, he didn't explain anything to me. He didn't even ask how I was. Like, I mean, I asked him. I was like, hi, how are you? And and then he was like, how are you? But like, his bedside manner was terrible. All he asked me was, what's your pain level? And then he asked me to sign the consent. He didn't even go over what the consent was. And then I started reading it. And then he was just like, okay, I'm going to mark you on your back. But like, he didn't even say, this is where I'm going to put the injection. Like, nothing. He didn't say anything. Yet there was a patient beside me, so it was like a really quick, maybe 2-minute thing. Like, I asked him what medication he was going to inject, and then he told me, but there was no conversation. There was really nothing. Not like, okay, how's your leg been? Did you start PT? How's that going? What medications are you on? I don't know. Anyways, yeah. So, but the worst part was that the patient next to me, he went to go see the patient next to me, and with her, I could hear them talking, you guys, and he was asking her, what makes your pain worse? Have you tried this medication for your pain? Is your pain sensitive to weather changes? Like, he was talking to her more, and he was like more attentive to her, it seemed. Really made me mad. So then I was thinking about my doctor who does my nerve blocks for my neck, and how just different he is. Like, he always goes the extra step for all of his patients. And this new doctor, he was just like so horrible. Like, he didn't even care. He was so apathetic. It seemed like he didn't even want to talk to me. He didn't even like me. So then I started getting really like anxious and really sad when I started thinking about, my other doctor, because this is one of the problems with seeing new doctors, is that you don't know if they're going to be good doctors. You don't know if they're going to treat you well, And so, yeah, it happens that this new specialist, like, was so apathetic, didn't even bother to talk to me really. He was just doing his job. Okay, but this isn't like the worst part. Then, like, I was just confused the whole time. Nobody really asked me, okay, you're next, it'll be a couple more minutes, and nothing. I was just waiting there by myself, and I was telling my sister, like, what the fuck? Like, this is like one of the worst experiences that I've had. And then my temperature strips fell down from my feet. They put temperature thermometers on my feet, and they fell down, and like one of the ladies literally picked it up from the floor and stuck it back on my foot, even though it had fallen on the floor. And like, I don't know, that's just not that hygienic, And then, okay, finally somebody comes, she's like a nurse, and then I ask her, are you going to be administering the sedation? And then she told me yes. I mean, she didn't even tell me that before. She just said, I'm gonna be in the room with you. She didn't really say much, Yeah, it was just confused. I was so confused about who was doing what and what role they had and all that. So, I asked, and then I told her. She didn't even ask me, have you had any problems with sedation before? Have you, like, So then I had to tell her, like, I usually get nauseous. I usually get, like vomiting sometimes, upset stomach. It was just horrible. So they took me back, and then she started working on me really fast to prep me. And then, mind you, I was still in like my street clothes. Like, they didn't have me change it to a gown or a hairnet. And nobody had explained that to me before. So I was in my yoga pants and like my t-shirt, and then she just had me lay down on this bed with 2 pillows propped up. And then she was working so fast on me, and like, it was like a fast food restaurant. It was just like insane, everything was so rushed. Like, they could barely talk to you because they were so busy trying to get you ready. And then somebody else came, and I'm assuming she was a nurse. Like, I think she said her name, but she didn't really say what she was there for. I don't know. And then the doctor came in, and you guys, like, he did not say anything. While I was there, he was just joking around with the other nurses. Okay, he was just joking around with the other nurses, talking about like a TV show. And that was it. Like, he never said, okay, so now I'm gonna go in with the needle and you're gonna feel this. Nothing, you guys. Nothing. It was fucking... I'm so fucking pissed. You guys, I'm pissed. Because the doctor, he ignored me while I was on the bed getting this nerve block done. He didn't say, okay, now I'm gonna put in the you know, the numbing, like nothing. He didn't walk me through anything. He didn't say, okay, I'm almost done. Nothing, you guys. I'm telling you guys, I was just ignored completely, and I had to be quiet. Like, I didn't know what to say. After they were done, they did Versed and fentanyl, but after they were done, I just cried, like, on the table. I started crying. I don't really know why. I just felt like an overwhelming feeling of freaking sadness, and it was just horrible. So then one of the ladies told me it was just like the medication, that it's normal. So then they wheeled me back to my to the recovery room in this chair thing that they have, which really felt dirty, you guys. I'm not even kidding you. It felt like a dirty chair that's never been cleaned. And they didn't even provide me with a mask. I saw some people wearing masks, like cloth masks. Unlike the other surgery center that I go to, they give everyone a KN95 mask. But like, yeah, so then in the recovery room, it was just, everything was awful. One of the nurses literally told me, how soon is your ride going to get here, because I need your bed for other patients. And I had only been in the recovery room for like less than 5 minutes. She was like, okay, and she was telling me this even before I was allowed to leave. She was like, okay, we're gonna keep you here until 2:55, and then okay. So then I called my sister, but then the lady was like, how soon is your ride gonna be here? We need your bed for other patients. And like, it was horrible. It was horrible. You don't tell that to a patient. Guys, my sister called me, so the video cut out. But what I was saying, it's not my problem if you don't have enough beds. Like, you don't tell a patient that you need their bed, so hurry up and get the fuck out, you know? And then afterwards, like, they didn't even wheelchair me out, she just like walked me to the door, stayed in the building, and let me walk out, even though I'm a fucking fall risk because of my leg and like of the medications. Like, are you kidding me? It's like the worst experience at a surgery center I've ever had. And I have an appointment with my doctor next week, but I don't even know if I want to go back there. Like, it was horrible.